But again, thank you so much. And really, I just wanted to touch base and see how you are doing and what's happened in these 6 months and how you feel about nursing, how you feeling about school. Just what's your story now? What's happening? What
Well,
happened over
so
this month, few
it's
months?
really, yeah, it's really funny. I feel like in my last interview, I was not working because of COVID. And then I eventually went back. And so I did work at that job for a little bit. And then I actually got a position in the ICU at NCMC. So I'm now working like exclusively with COVID patients, which is a complete 180 from what I thought I was going to be doing like 6 months ago. So, because I was just so scared and with all of my underlying things, but we're literally on the brink of people being able to have a vaccine. So it's also really crazy to think that like I wouldn't say we're figuring it out. I feel like it's a lot of maintenance and trying to just get people better and making observations about what's happening, because you see like very weird symptoms with certain people and then other people it just doesn't affect as much, which like gratefully so. If we all, if everyone reacted the ICU way, I don't know what we would do. We're already overbooked as it is. So that's like very strange to be like observing the pandemic in that way. But it does give me hope that like we can figure this out and hopefully kind of stabilize it as we collect more data, help more people, whatever you want to call it.
Right.
So yeah, that's been like the biggest change. I took that job and I remember being like, oh, I'm just so excited to be in the ICU. And then my parents were like, but you mean that, like, you do know that means like going and working with COVID patients. And we are like doubling up rooms and things over at Banner. So it's the whole works. It's the whole works, just like the first time around. But I'm really excited to be able to do this. And I think it gave me a really good perspective on like, maybe I don't want to start in the ICU right off the bat, or could I at this point? It's just a whole nother world. On top of learning ICU, you'd be learning COVID ICU, which everyone seems to be perplexed by. So it'd be like a huge learning curve, which I did not realize. I was like, oh, maybe I could be one of those people, and now I'm like, I don't need to be one of those people.
That's true. They are taking, the nurses are having to learn ICU skills so fast.
Yeah, truly.
That's a scary situation.
Very, very. But I feel really good with the PPE. I have not had no symptoms.
Good.
So that's super great. I like, because there's such a range of how it affects people, I'm kind of nervous to see like how I would respond. But like one of my friends right now in the cohort is sick with COVID, and like she's just chilling at home. And it's like a flu on steroids, but like she's not going to be hospitalized, so like I don't know. I wonder if it would be like that for me, or if it would be different. Like I don't know, but that's like the scary part, is like you really cannot predict it. So
no, I think that is really the thing, is you don't, every person is having such very different symptoms. And so I think maybe you can speak to this, is I've always, when I taught nursing, it was like, you got to use some of your intuition, your experience, and you have to adapt and change for each patient. Do you feel like that's what's continuously happening?
Oh, absolutely. Which is almost the best part about nursing, is that it is individualized. Like there is no prescription plan. Besides, obviously they're figuring out, okay, we need to do Precedex for this, or figuring out different combinations and doing like the proning and the supining. Like they have different techniques, but I think like you do have to look at each person's specific comorbidities and figure it out based on that, rather than, well, okay, it's just, it's type 2 diabetes. We know exactly what to do for this, or, like the care plan packages, I guess.
Exactly.
So that's really cool. And I think like I feel like I probably said this 6 months ago, but the reason I love nursing so much is that you're continually learning. And I feel like this is just another example of how, even if you feel it like you're at the top of the game, you're not. And there's always room to grow, and there's always things to be learning. Even the doctors, you know, and that's really cool too. I love that it's really focused in nursing, but it's truly a team effort. Like I've loved seeing like the interdisciplinary approach to the ICU that's going on right now, just because it's like, right, like we are a team and we're truly all here to make these people better. And like that feels really good at the end of the shift of like, it's been like 12 and a half hours. I'm like so tired. I've been like running around, like sweating in my PPE, but you end the day and you're like, and I helped somebody today, like truly, you know? And I think that's the whole point of finding your niche in nursing. So maybe I'll end up in the ICU. I don't know. I'm kind of having like a career crisis. I like thought that I thought I knew what I wanted to do. And now I'm like, well, I don't know if it's going to be like COVID. Like that's a whole different thing. So that's been really interesting because I would have never thought that something would have, like, I felt very headstrong about it and I wasn't going to let anyone tell me no. And I feel like the pandemic was like, hey, no.
Right, give you a different reality check.
Right. Right.
Yep. And I think that's huge with what you said, that you're walking away feeling good about what you did. And I think nurses need to feel that. And this pandemic has pushed them to the brink. But the key is to walk away from the end of the day thinking, I did something good. I was a good nurse. I was a good CNA, you know, good therapist, whatever.
Or we were just a good team, you know, like we did a good team job today. And I think honestly on the unit we have helping hands that come in and help so much offload some of the like, oh my gosh, I have like 8 patients today. And it's like, no, you actually don't. Like you're going to split it with another nurse who's in the building and, you know, has been a nurse for a while. So not that they know the ICU, but they can help out with the nursing side and then the CNA side. So that's been so helpful, just to feel like we do have other people in different departments that want to help and they do care. Because I feel like there's also kind of this attitude, which is fair enough, because that's exactly where I was. I was like, no, I'm not going to that unit. Like I will literally not work in that. Like that was me at the beginning, you know? And so I think like having people that are so enthusiastic about coming and helping for 12 hours or even 8 hours, it's like, yeah, people care and people really like this. We are a team in this. Like you're never alone. And I love that. I love that.
Right. I remember that feeling when I worked ICU. It really, and I think I've seen it on the other units too, but there's something different about the ICU that it really is a team effort.
Oh my, yeah. And just some of the, like watching somebody destat when they stand up and just having that, like I was helping this woman and she got up to use the restroom and literally her stats, and then like other things happened, but her stats went down to like 18. And I was like literally panicking so hard. And like the nurses came in and they were like, put the nasal cannula back on. Like it was a whole thing. But that's how much like this, like COVID is affecting people, is like people cannot even stand up or even like sit on the side of the bed. And like that is so impactful. But to have your team behind you in those like panic moments of like, oh my gosh, like what are we going to do is so important. And wherever I go in nursing, I want that. I want
absolutely. That. Yes, absolutely. That's huge. Well, tell me how it's been to be a nursing student through all this.
Oh. I feel so, okay. So I was so excited to be able to go to children's, and I actually did a rotation in the NICU, which is really funny because I really want to do acute care, and then the stars aligned and I got to do NICU, and it's a whole other like bear of acute care. Emotionally, not physically, which is very attractive to me as a new grad. I'm like, hey, that would be great. But like emotionally, that is so taxing, so difficult. And you definitely need like the teamwork and just the support of your management in that situation, because you deal with such difficult family scenarios. And I think in the ICU, I've been able to kind of use that experience and take it over, because people and right now it really stinks because family members cannot go visit at all. Like there's like very strict restrictions, and people are kind of going crazy, as they should. Like if my dad was in the ICU, I'd be going crazy too. But I think it gives me a little bit more perspective too of seeing people in that scenario and giving me the empathy of, right, and that is terrible. It's hard enough when you're there with them, let alone the entire hospital telling you, no, you can't.
Right.
And obviously there's exceptions for kids, as there should be. So that's another thing about the NICU too. But yeah, children's was amazing. That was such a good experience. And I'm so glad that, and it was an intense, like 6 weeks that I did that, because like a group of us got a hotel room right across from the hospital, and we would go down at 2 p.m. the day before and like do prep work and be there, like, so we'd be down in Aurora for like 2 days every week. And so it was so intense. But I remember just thinking, like, but we get to be at Children's, you know, like we get to be here. And every day being in the NICU, I was like, this is such an honor. Like, this is so crazy, you know? So I loved being in the NICU. It definitely taught me that I need to like strengthen my emotional like skills, perhaps, my coping, which actually I'm starting therapy today. So I'm very excited to have reached out for that resource, because I feel like so many of my nursing preceptors who are in acute care and see very difficult situations, they're like, just do therapy, just have somebody on standby. Like, it's so important to just have somebody that's qualified and isn't just one of your family members, to be able to say, like, this is what I'm going through, and clinically they can say, okay, and here's what you can do about it. Because it's one thing to have family members, but like, they don't understand what you see. And even if my therapist today is like, I've never seen that, or like, no, I've never seen anybody code. Like, they're clinically trained to handle, and in a sense, seeing a code is traumatic, because it's watching someone die. And I think that, so it's funny, because I went from and it's not funny, it's really terrible, but I went from the NICU to doing ICU, and just the amount of like death concepts that suddenly became part of my life was very intense. And so that's why I'm really excited to start therapy, because I feel like you can get in such a dark place so easy when you're just handling that stuff. And not that you're never going to get somebody that's holding your hand through it and saying, oh, you're fine, and like, this is what you're going to experience when you first see your code. Like, I thought I was fine for like the first 2 days after I saw the code, and then I broke down. So it's like, I need to learn like my own emotional coping and how I respond to these things, and how to make it more healthy for me, so I'm not just sitting here. Well, the terrible thing about that too, so NICU, and that was amazing, but by the end of it, I was like, I am so emotionally drained, like seeing these families and seeing these babies, and like, it's all so unfair. Like, how is anyone supposed to like reconcile this in their head any given day? And then I go and I do my OB rotation, and you're literally seeing women like give birth, like they're bringing life into this world. It's amazing. But that Sunday I had been working, and I saw my first code, and I literally watched this man die. And it kind of hit me on my clinical day. I was watching a C-section. I remember being like very underwhelmed. I thought it would be like more exciting, but it's literally just kind of taking the baby out. And honestly, the stitching is like a huge part of it. Like the after the baby. So that was really funny to get that perspective of like, oh, okay, like maybe I don't know if I'd want to do C-section surgeries all the time if I was working in the OR. Like, that wasn't like my cup of tea, or like, I don't know. It was all a very good experience. And it's funny, because I was actually interested in women's care before I like went to nursing school. I was like, oh my gosh, I'd love to be an NP, like all these things. And now that I've been through my OB, I'm like, no. Like, I'm good. So it's so valuable, but it was really hard being at work 24 hours a week, seeing all this really intense stuff, and then going and being a student, which I am so over being a student. If I wasn't over it last semester, I'm definitely over it now, because I just want to be in there and I want to be making a difference. And it's really hard when you're like, for safety reasons. I'm not saying like I should be administering medications at this point, but it's really hard to sit on the sidelines and be like, oh yeah, she's a student, and have people be like, oh, I don't want to be a student. And I'm like, no, I'm not trying to be a student. I'm trying to be a nurse. I'm like, I'm trying to be your nurse. Like, it's so frustrating. So that was kind of hard. Like, yes, we were able to be in the clinical setting, and that was amazing. But having kind of those extra elements of, but you're just a student, and no, you can't do that. And especially in OB, like, it's very specialized to the point where like, I wouldn't want to give medications. Like, I don't know how to, like, I don't know. So I think that was like probably like the biggest setback for me. And it really affected my attitude because I was like, then what am I doing here? You know, like in med surg, they're like, go do it. Like, go do IVs, go do the drugs, like, go do everything. And we only got 4 weeks of that. So I was really excited. I think my brain was like in that perspective of like, oh, let's get back into it. And then OB was very much like, can you just like stay over there? Can you like stay out of my way? And I was like, of course. But
yeah, it's definitely more hands off as a student in those areas.
Yeah.
That's hard.
Yeah.
Do you have? Go ahead.
Oh, I was just gonna finish up the other thing that made me think of that, which was it was like on my clinical day that I kind of realized the impact of seeing a code. And so at my clinical conference, I like kind of flipped out. Like I kind of like, I was just like, how do you deal with any of this? Like even on postpartum, like you still, well, because the woman that I had watched the C-section for kind of had a weird psychosocial situation where she was upset when the nurse asked about who the father was, but her current boyfriend, who was not the father, was not present at the birth either. And I was like, that's very interesting. You don't get that every day. I think when you think of, I mean, and this is really funny because my last week that I was on labor and delivery, I had the Disney couple. That's what I like to call them, because it was like the perfect like 34-year-old doctor, and like she had her husband there, and like she had her kid like taken care of by her family, and she was like so excited. So it was like, and that's what you expect, you know. But I think if I had learned anything from the NICU, that's hardly ever the normal scenario.
Right.
And that's so unfortunate because that's what we all want, right? But that's just not real life. And I think as healthcare providers, we need to be prepared for that, and then just be really happy when we can hold on to like the perfect scenario, you know, because otherwise it's like, wow, this really stinks. Like, where is that kid going? And what will this kid do? And what will this kid have to be forced to experience because of this scenario that we see, and we see all the warning signs for, but that's not your scope of practice at that point. You can only do what you can when they're there. And that's hard to grapple with, I think. That's really hard. Because like as a nurse navigator, like that was another thing that I learned about, which is like you can literally go in and like help them with everything. And I was like, that sounds great, but I feel like my mental health would like tank if they relapsed or something really bad happened. And I felt like I was responsible, even though it's not. You can't do that. So I feel like at the hospital, at least it's very like concentrated. You know that you have to do whatever you can from the time that they get admitted to the time that they get discharged. And anything after that, you can't make it your business,
right?
Because it's not your scope. So I like that, and I like the fact that this job is a clock in, clock out kind of dealio. Because I feel like a lot of jobs, I mean, especially with nursing, like you cannot take it home, but you literally shouldn't take it home. Like, it's very much like on site. You have to be there, and when you change out of your scrubs and you take your shower, like you're done, and you can be done. So I'm appreciating that a lot. But going through kind of like these, I feel like it was just a cacophonous experience of watching a code and then helping a woman bring her baby into this world. It was a very like turbulent week emotionally. I was like, what is going on?
Absolutely. And I think it's great that you have that self-awareness that it's like, okay, yep, we need therapy to be able to just talk things out, talk through it, and like a debrief. You do the debriefs for all your simulations, I'm sure, and you need it for yourself and your own emotions, and that's huge. That's great. Are you working as a CNA then in the ICU?
Yeah.
Okay.
Yeah,
so
I'm a tech. So
how do you feel? Do you have role conflict? Because you're close. You're almost to graduation. Do you have conflict between what you're allowed to be doing as a CNA versus what you can actually do as a nurse?
I think honestly in the ICU it's very different. I think maybe if I was on like med surg or tele, it would be like, oh, but I can jump in. But I feel like ICU, it's like, no, you do that. Like you go ahead and push those crazy drugs. Like you go ahead.
Yeah.
So honestly, yeah, I feel like it's more of the learning and watching nurses that I think is what makes it all worth it, because there's so much learning to be had in the ICU. And it's almost the same, like what I loved in the NICU is that you get kids with conditions that like seasoned nurses have never seen. And it's the same in the ICU. Like it's all a big puzzle, and I'm obsessed. I know that I'm a nurse for the problem solving. Like I absolutely know that. So that's what makes these acute care situations so exciting. And just, okay, like how can we help this person, and let's watch them improve. And I like learning all these little skills so that when I go out on the floor, I'm not struggling with one more thing, you know, because I'm already going to be struggling with like trying to get my routine and just establishing myself as a new grad. I think if I can not struggle with my restraints, that would be great. Or if I could like, you know, just quickly change a bed with my CNA, I think that'll make it the transition way smoother. So I'm definitely excited for all of that, because, and the other thing too is I could go on the soapbox that every nurse should be a CNA. I don't think that there should be an option to refuse that, because you are an extension of the nurse. They are asking you to do things that they would normally have to do, but you get to be there and you get to do that. And in the ICU, that's what I also love about the ICU, is that you are there to help them. You're not there to do separate CNA tasks.
Right.
And I really like that compared to long-term care, because I feel like the nurses and the CNAs are just very separate staff, which is just not true. That's just not real. In terms of, it's a certified nursing assistant for a reason. Like you are there doing nursing tasks. And I think the ICU reminds me of how important it is to take the time and put in your experience and learn these skills, because they don't go away. And I don't want to be that nurse that's like, you know, oh, well, can you do that? Because, you know, I'm busy. Like, no, you're a nurse and this is what you signed up for. So don't pretend like it's not yours too. Right. So and that's my little soapbox. Because I feel so strongly, I do. And I think every single nurse I've told I want to be a nurse, and that I want to be a nurse too. They're like, you're automatically going to be so much better because you value being a CNA before being a nurse. And I'm like, then that makes it worth it. Then that is exactly what it does.
Right. No, that makes a lot of sense. You're able to be, without being thrown in to this new situation, you're able to see how this works and see how the team works, and see all the roles, and that's huge.
Right. And that's invaluable. Like what else is clinical? It's getting in there and just seeing and getting to talk to people about dynamics and observing. And I think honestly, like it's not that much harder than what I was doing in long-term care. I think in some ways it's actually kind of easier, because you are part of such a big team. And I love that. I felt pretty isolated in long-term care, but I feel like here it's very valuable to be part of the team. So I really appreciate it. And that's things that if I never took the chance and applied, well, and it's funny because I actually applied for the PCU to be an aide over there. And when I was doing my interview, I was like, I'm willing to learn anything. Like, I'm so excited. Like, I will, you know, like I'm here to learn. Like, I have a year left of school, you know, like I would love to just get in there and see whatever you guys can give me. And they called me back and they said, well, we had a staffing issue in the PCU. So that position like no longer is available, but we have an opening in the ICU in about a month if you're willing to wait. And I was like, yes. Yeah. Because that was the unit that I actually wanted, but at that point I was like, a step down is still really good.
Right.
So I'll do that just to have anything going in as a new grad. Because the other thing too is I was looking yesterday at the new grad program at Children's for the NICU. And if you just need any kind of acute care experience, whether that's in your preceptorship or if that's in CNA experience, EMT, advanced, that's like the advanced care, ACP. Yeah, that's what it is. So if you have any experience, you're automatically a leg up. And I looked at that and I was like, and that's what makes it worth it even more, because as hard as it is, and as many nights as I've been like, oh my gosh, what am I doing? Like, this is way too hard. Like I could just be doing school right now, or I could like be enjoying, I don't know. With COVID, it's kind of hard. So it's really easy to be like, no, I should do this. But either way, like that gives me an entire year of paid experience in an ICU during COVID. You know, like that just gives me so much a leg up for other people, because I feel like a lot of people are like, oh, well, I can't get in the ICU because you know, like they just won't, they're not accepting. Like Banner does that. They told me straight up, because I asked them, and they were like, we really don't take new grads on the ICU. Right. But my clinical was like, you shouldn't. Like, I wouldn't recommend that for anyone, because our ICU is very intense. Like it is not like a walk in the park. I mean, the ICU isn't anyway, but I think she knows her department enough that she was like, I would never recommend that for you. It would be, you know, it's a safety issue at that point. And I think about being on my own in a year, and I'm like, absolutely. So I think in terms of going that direction, I would definitely go PCU or even med surg at that point. But it's cool to think that with this experience, I could boost myself into the NICU if I wanted to, or if I went to a different hospital and they had a more comprehensive orientation, you know, a new grad program, that I would have a leg up and have this experience to say like, oh, well, I've seen it, and you know, I've done some of the emotional legwork to be able to handle it, because the burnout rate is insane for new grads. And I think even working as a CNA in the ICU, I'm like, I see it. Like if I had tried to jump in, I don't know what I would have done. So I'm so appreciative that my brain is so, I don't know, like type A OCD about just getting as much experience as I can, because I think I'll really appreciate it by the time I graduate next August.
Right. But you're so very realistic about, I mean, you are, and I said it earlier, you're just self-aware. You know your limits, you know what's best for your career. And I think that's a lot of emotional maturity in there. Just,
I hope so.
And that benefits you as a nurse. It's huge. Yeah. I mean, because I mean, I know there's plenty that I'm going to go right into ICU nursing or ER nursing. That's what I want to do. And you have to be aware of, okay, what are my own limitations and what's the best path for me? But I mean, this experience you're getting is huge.
Absolutely.
So that's wonderful.
I'm so grateful.
What have you guys been doing for your theory classes? Are you on campus at all, or has it all been virtual?
It's pretty much been all virtual. It's pretty much been all online. We were doing a couple labs on campus, like really scattered throughout the semester, and only in groups of like four to six, depending on what the like state said. Right. And then we had like you had goggles or glasses, like your mask, a shield, gloves. It was like a whole thing. So even when we saw our cohort, we didn't really see our cohort. So that was really sad. And I think we all kind of had this discussion in our evidence-based practice class, but it was like, describe a problem and then describe like how you needed support or like what you would change about it. And I feel like half of the class was like being told that we were just going to be online all of a sudden, and then really feeling like we were thrown into it. That was like and I also said that. I was like, it was very frustrating feeling like we were just thrown into the situation and not necessarily given like limited communication, but it definitely didn't feel as comprehensive as my anxiety definitely would have it. I was very nervous and some people are not even getting a pediatric rotation due to COVID, and they're like trying to fit it in next semester, but it's kind of looking bleak, and it's like then they just miss an entire chunk of clinical time. Which is actually a concern for graduating. So like it's getting kind of real, and I think there's a lot of things where, I'm not on the management side, I'm not on the faculty side. I don't see that, and I definitely know my limitations in that perspective. But I do know that sending a quick email or a quick update goes a long way, and I really wish that was like just valued more. Right. That's been kind of frustrating going through that. Is kind of like, we're already in our own little pods, like far away from each other, when we used to be like at the hip, like 4 out of 7 days plus clinicals. So it was just way more of a family, and now we all feel very like disjunct. And I definitely didn't realize like how much that meant to, and I did really well this semester, so I don't even mean to say like it's affecting my learning, but definitely felt more connected when we were all learning together and suffering together. I felt very well, and hence why I'm getting therapy. I think like I felt so alone, and my partner doesn't understand what I'm going through for good reason, because he works at a grocery store. Like that's a whole different bear that I don't understand. So
Exactly.
you know, like I can't pretend to understand that, and he can't pretend to understand what I'm going through. But what I'm going through is really hard and really intense, and has very big implications for where I'm going in life. And I think I need to sort that out. So in terms of how it's changed my view on nursing, I need to figure myself out a little bit more before I can go out and tell other people how they need to manage themselves.
Sure.
Because it's been hard. It's been really hard. And in terms of being open about where I'm at, like I'm usually not, I'm not going to hide in whatever I'm doing, but I was trying to be strong this semester. I was like, no, it's not that bad. Like, I'm not eating a lot, but it's okay. And like, I'm not sleeping great, but it's okay. Like, I was definitely doing some of those bad things. And now I'm like, no, like you need to eat, you know, like you need to be moving your body. You can't just like not go to the gym or not go outside, you know, like that's, and so in terms of like the things that I'm facing right now with my mental health, I can see the direct pathway, but I also understand a little bit of where, like kind of where that happened. And I think part of it was that I was definitely isolating myself, being like, well, you know, whatever, like everyone, you know, we should social distance, which we should, but it doesn't mean you can't send somebody a text or, you know, call them or set something up like that. And so I think COVID's really forced me to be more creative about how I like go about social situations, or how I go about, and even I don't think I would have had to tackle my mental health like I have had to this past semester, because it has just been so hard, and feeling alone in it just makes everything worse tenfold. So I'm excited to at least have this semester as like a foundation of like, so that's how bad it can get.
Exactly.
But like I feel like you have to start, you know, have a perspective from somewhere. And I feel like this situation could easily be transferred over to being a new grad, because you can absolutely make yourself feel alone. You are new. Everyone else has been there. So I think there are many applications to this situation, whether that be in my next semester or, you know, in my first job. I think I'll be able to take these experiences and how hard they've been, and just like where I feel like my attitudes have faltered, because I felt like such a bad student this semester, you know, like we were able to go to PVH, and I was like, yeah, but I would rather be at home. And like, that's terrible. That is so terrible. And I want to take that next semester and say, no, we get to be here, just like I felt like in that NICU, and use that as fuel for a better attitude, rather than, you know, oh, well, we have to be here. And I mean, 13-hour shifts are really hard though, especially when you're not getting paid. So that was just especially when I was already doing 24 hours paid, and that was hard enough. But that was on me, right? And I think as a new grad, you're gonna have to work 36 hours a week, and you're gonna feel like you're drowning for like 6 months, and like it is what it is. So I need to get used to it, you know, or I need to figure out how I can get through that and not be like, oh, I have to be here again. Like, no, first of all, you get to be paid, you get to learn, you get to, you know, this is a foundation to the rest of your career. Yeah, as I'm already saying, I'm already hyping myself up, but it's stuff like that where I feel like I kind of faltered a little bit, and I usually don't. I'm able to be really optimistic and, you know, push forward and be like, no, we got this, and like this will be fine, and this is just a little blip. But I feel like this semester kind of defeated me, and I feel like that's a really commonality among a lot of people, is that it was just a lot.
Definitely. I think the pressures and you know, when we were talking earlier about teams, nursing students are a team. They get each other through. And so to not have that camaraderie and going out for drinks or dinner and that kind of thing, that's really hard. That's a way to decompress. So you had to, you know, with things being in isolation, you have to find those things on your own now, and that's a challenge.
Right. And I feel like some of the friendships that I did really solidify this semester were really great, you know, but I know I have some places where I don't want to, talk about that with some of those people. Or even my partner. I mean, it's hard to have all these really intense feelings and then feel like no one understands. Even though people understand and you're working with them, but you don't want to like burden them, and you just want to be fine. Like you don't want to have the problems at all, but that's not life.
Right, exactly.
So,
oh, that's great. And so what are your plans over break? Are you staying in town, or are you going back to your family's house, or?
Yeah, I'll be working like full time.
Okay. I figured they're going to use you. Yeah.
So I'll be working just to like get more experience, boost it, feel more comfortable on the floor, because I'm barely off of orientation. I think I'm like 3 shifts off of orientation. So I'm still very new, still have a lot of questions. But my dad and I, well, I say my dad and I, but it's really the family and I, because my dad is the most concerned. We're gonna do a Zoom Christmas, just like we did a Zoom Giving, just because it's like with how often I'm working with COVID patients. And I mean, I could definitely go get tested and be really neurotic about it, but if I'm not symptomatic, I want to save those tests for other people.
Right.
So, and just to see that I'm negative so I can go see my family, just doesn't, as I told them, I said, if we have one Christmas apart to have many more together, then that's way more worth it than risking this one and then we get none together ever again. Like, that's crazy. And some people are making that choice, but that will not be a choice for me. Absolutely not. I have seen family members die. I've not mine, but seen other family members die, and I know exactly what COVID is. It's crazy to think that people still think it's a conspiracy, considering that's my job right now, is to take care of the conspiracy. So
exactly,
that's great. But I firsthand know the impact, and so in that way, I'm very protective of my family and saying, we can Zoom, guys.
Yep.
We're not risking it.
That's good.
So,
that's good.
Yeah.
Well, and I'm sure your partner who's working in the grocery store, he's just at risk too.
Absolutely, right. And I think he was talking about maybe going down to see his family, but even then, I don't know. And they have such a huge family, and that would be a whole thing. So we'll see. It's still kind of all up in the air, and it really depends on like what time he gets off, which, if any at all, because his work schedule isn't great either. And I actually work Christmas this year.
It is different when you start, when you get into those jobs and you start working all these holidays, it's different.
Like, what?
I know. I'm supposed to Christmas, everyone should just be closed for Christmas, but no, you still keep working. Exactly. Oh, goodness. Well, thank you so much, Emma. I really appreciate you taking the time, and I just, the growth I've seen, even just from your first interview, and like how confident you are in your abilities and being a student and becoming that nurse is huge. It's great.
Oh, thank you. It's a continual process. I feel like sometimes it's really slow, but that makes me really happy to see that, like, or to hear that you see it.
Yeah, I do. Just in our, those 2 different meetings, that's huge. All right, Emma, thank you so much. We'll be in touch, and hang in there.